There were 7 people in the trauma bay when Rear Admiral Steven Greer was wheeled through the doors at Harmon Veterans Medical Center. And within 40 seconds he had ordered 6 of them out. The flight medic who arrived with him had already radioed ahead. Multiple gunshot wounds to the left shoulder and upper chest. A scalp laceration, running 4 inches above his right ear. Possible internal bleeding, blood pressure dropping. What the radio had not conveyed was the Admiral's state of mind, which, despite all of the above, remained formidably intact. He was conscious, oriented, and deeply uninterested in accepting care from anyone in the room. "Back up," he said to the resident who reached for his IV line. His voice was hoarse from the flight but carried the quiet authority of a man who had spent 3 decades giving orders that other people did not question. "All of you, back up." Dr. Sean Tarver, the attending trauma surgeon on call, stepped forward with the particular calm of someone who had managed dozens of combat veterans through exactly this kind of situation. He introduced himself by name and credentials, and explained with genuine patience that the Admiral's injuries required immediate intervention. Greer looked at him for a long moment without answering. Then he said, "I want Nighting." The word landed in the trauma bay like something dropped from a height. Dr. Tarver processed it twice before responding. "Sir, I'm not sure I understand. Is that?" "Nightingale," Greer repeated. "Get me Nightingale, and then I'll cooperate with whatever you need to do." The nursing staff exchanged looks. The charge nurse, a practical woman who had worked Harmon's trauma floor for 11 years, pulled up the hospital directory on the wall terminal. Before Dr. Tarver could ask her to, she searched the staff registry. She searched the volunteer database. She cross-referenced the on-call list for the night shift. Nothing, no employee, no contractor, no affiliated provider at Harmon Veterans Medical Center bore that name or that call sign or anything remotely close to either. "Admiral," Dr. Tarver said carefully, "we don't have anyone on staff by that name. Is there a possibility?" "It's not a name, it's a call sign." Greer's jaw tightened against whatever pain he was managing to suppress. "And whoever told you she wasn't here was either wrong or lying. Check again." Dr. Tarver exchanged a glance with the charge nurse. Neither of them had an answer for that. The working assumption, not discussed aloud, was that the Admiral's head wound was doing some of the talking. That Nighting was a fragment of memory, scrambled loose by blood loss and altitude, and whatever had happened to him in the hours before this helicopter landed. It was a reasonable assumption. It was also incorrect. The door to the trauma bay opened at 11:58 p.m., and Margot Finley walked in. She was not responding to any summons. She had no idea a helicopter had landed 17 minutes earlier, no idea that an admiral was bleeding through a battlefield, dressing on the gurney 12 feet ahead of her. She was there because the patient in Bay 4 had a call light on, and she was the nurse assigned to that corridor, and she did her job with the same quiet efficiency she brought to every task on every shift. Clipboard keycard. The soft-soled shoes that made almost no sound on the floor. She was 32 years old, slight, in the way that people sometimes mistake for fragile, before they've watched her work. Brown hair kept in a low bun, no jewelry on shift, and a habit of keeping her sleeves rolled to the wrist even through July heat, which her colleagues had collectively decided was just a personal preference and nothing worth asking about. She had transferred to Harmon 20 months ago from a position in Portland that she described as general acute care, that nobody had looked into too closely, and that looked perfectly ordinary on paper. She was 3 steps into the room when Rear Admiral Greer's head turned. He did not speak immediately. He simply looked at her, and the change in his face was not dramatic. It was the opposite of dramatic. The tension in his body shifted in a way that had nothing to do with pain management and everything to do with recognition. The way a man who has been searching for something in the dark shifts when he sees what he knows. "Her," he said. Margot stopped. "That's nice" was low, and the certainty in it was absolute. "Her, I only accept her." The room turned. Margot felt every pair of eyes in the trauma bay settle on her like a weight, and she kept her expression level. She had practiced keeping her expression level for long enough that it required almost no conscious effort. But her grip on the clipboard tightened a fraction of an inch. "Sir, I think there's been some confusion." She addressed him directly, professionally, the same tone she used with any patient who was disoriented or in pain. My name is Margot Finley. I'm a floor nurse assigned to the adjacent ward. I'm not who you're looking for. Steven Greer studied her the way men study things they are very certain of, and very tired of being asked to doubt. His eyes moved from her face to her hands to the angle of her stance, weight on her back foot, body positioned toward the door. And whatever he found there confirmed something he had already decided. You're holding your left arm against your side, he said quietly. You've been doing that since you walked in. You always do it when you're calculating how fast you can exit a room. The charge nurse blinked. Dr. Tarver went still. Margot did not move. Kandahar Province, Greer said, October. 3 years ago, our convoy hit an IED on an paved stretch 4 km outside the forward operating base. Vehicle 2 was fully engulfed. I had 2 men trapped inside. He paused. The cardiac monitor on the gurney continued its indifferent counting. You came out of nowhere. Nobody in the AO knew you were there. You pulled both of them clear. You performed a needle decompression on Petty Officer Crane with a stripped-down field kit, while the vehicle was still burning less than a meter from where you were kneeling. Then you were gone, before the quick reaction force even arrived. The trauma bay was so quiet that the sound of the monitor felt very loud. Petty Officer Crane is alive, Greer said. He has 2 daughters now. He still talks about that night, but he never knew your name. Nobody did. But I saw your face. His expression did not change, but something behind his eyes pulled taut in a way that had nothing to do with his injuries. I spent 18 months trying to find you. Your service record had been redacted back to a personnel number. 3 separate requests. I was told the individual was no longer in active service and all related documentation was sealed. Dr. Tarver stepped forward, feeling professionally obligated to anchor the conversation to something he understood. Admiral, with respect. This woman is a member of our civilian staff. She has held a nursing license with this institution for nearly 2 years. I know she has, Greer said. I'm not questioning that, I'm telling you what else she is. His gaze returned to Margot. I'm telling her that I remember. The moment that followed was one of those moments that don't announce themselves. It simply became the moment everyone in the room would remember for the rest of their careers at Harmon. Margot Finley stood very still, and the expression on her face underwent a change. So controlled it would have been invisible to anyone who wasn't watching for exactly that kind of control. Then Dr. Tarver reached for the IV line and asked for assistance, and Margot moved to help him. Automatically, efficiently, the way she always did, and her hand settled around the Admiral's forearm with a specific 2-handed grip that stopped her cold. It was not a technique they taught in nursing school. It was not something covered in any civilian curriculum she had ever sat through. It was a vascular access method from special operations, combat medic training, pure muscle memory from years of field rotations. See her thumbs finding exactly the angle that minimized venous collapse in a patient presenting with hypovolemic shock. She had done it before the thought to stop herself had finished forming. She felt Dr. Tarver look at her hands. She felt the charge nurse look. She did not look at Greer. She already knew what his face would show. That, he said softly, is a SCM technique. Standard nursing programs don't cover it. He let the observation rest between them. You can keep telling me I have the wrong person, but I've seen that grip exactly once before. And it was on a mountainside in the dark, and the woman using it was the reason my communications officer didn't bleed out on a dirt road with no name. Margot set down the IV line. She set it down carefully. She set everything down carefully, and then she stood up straight and looked at the wall for a moment before looking at anyone in the room. Whatever was moving behind her eyes, she kept it off her face. But her left hand crossed to her right forearm for just a second, pressing briefly against the fabric of her sleeve in a gesture so small that most people wouldn't have recognized it as anything at all. The charge nurse recognized it. Dr. Tarver made a decision that most trauma physicians in his position would not have made. He quietly asked the remaining staff to step out, citing patient privacy protocol, and they went. Because the room had taken on a quality that made everyone want to be somewhere they had better footing. When the bay was down to 4 people, Greer, Margot, Dr. Tarver, and 1 monitoring technician who stayed by medical necessity, Margot exhaled once, slowly, and turned to face the Admiral. You shouldn't have said that call sign in front of the full team, she said. Her voice was even. Not hostile, not frightened, just even. That designation exists in a sealed record for a reason. I know, Greer said. I said it anyway. I need thoracic surgery, and I have strong opinions about who is in that operating room. I'm not a surgeon. I'm not asking for a surgeon to hold my hand through it. I need someone in there who has held worse things than a scalpel and didn't lose their nerve. He shifted against the pillow and managed the pain with practiced economy. I lost 2 providers during the extraction tonight. I don't extend trust to strangers. And the only person in this building whose hands I've already watched work is standing right there. Dr. Tarver cleared his throat. I have to be honest with both of you. Whatever history exists here, and I'm becoming increasingly convinced it is significant. Miss Finley's current credentials are civilian. Including her in the surgical theater in any clinical capacity creates a liability question I cannot simply set aside. Margot spoke before Greer could respond. He's right. She said it plainly, looking directly at Dr. Tarver. That's a legitimate problem. I'm not asking you to pretend otherwise. Tarver studied her. She met his gaze without deflection. What I can do, she said, is be present in a support capacity under your direct supervision. I won't perform any procedure you haven't authorized. I won't document outside my scope. If you're comfortable certifying my inclusion under emergency exception protocol with a documented supervisor role, that's a conversation we can have right now. If you're not, I'll step back and accept that. It was the most words she had said in a single breath since anyone at Harmon could recall. And it was the way she said them. Clean, procedurally precise. No emotional pressure in any direction. That told Dr. Tarver more about who she actually was than everything the Admiral had offered. He made the call. He'd handle the paperwork when the sun came up. There is a particular quality to an operating room at 3 in the morning, when everyone inside it is doing exactly what they're supposed to do, and doing it without wasted motion. The monitors hold their rhythm. Instruments are passed and returned. The anesthesiologist watches his numbers. And occasionally a surgeon finds himself glancing across the table and registering, without meaning to, that he has never seen hands that steady in the middle of something this serious. Dr. Tarver registered it twice. Margot did not speak during the surgery except to confirm vitals, to anticipate instrument requests before they were verbalized, and once only, to quietly identify a secondary bleeder the primary surgeon had not yet located. She pointed it out at low volume in specific enough terms that Tarver found it within 10 seconds. He did not ask how she knew he was grateful. They closed at 3:47 in the morning. Greer's blood pressure had stabilized before 2. The thoracic repair was clean. Barring infection, which remained the variable that always remained, he would recover fully. Margot was still in the scrub room when she heard the door behind her. She didn't turn immediately. She finished removing her gloves and dropped them in the waste bin, and then stood at the sink with cold water running over her wrists, which was something she had done, after difficult procedures for so many years, that she no longer tried to explain why. He's asking for you, the charge nurse said from the doorway. Just so you know. I figured. You going? Margot dried her hands. Yes. The recovery room at Harmon was smaller than she'd worked in before. At any of the postings she'd moved through in the decade before Portland, under the name she'd used then. It smelled the same as every recovery room. Antiseptic, recycled air. The particular staleness of a space that never fully slept. Rear Admiral Greer was in the 3rd bay from the left, eyes open with the specific alertness of a person who had been fighting unconsciousness for hours and was mildly offended to have required assistance. She pulled a chair to the side of his bed and sat down. She didn't ask how he was feeling. She could see how he was feeling. You didn't have to leave, he said. He meant all of it. The transfer, the new name, the 20 months of ordinary shifts. I know. But you did. She was quiet for a moment. The monitor above them counted his heartbeat with steady indifference. After Kandahar, after the river crossing in March, after Brody. I lost 11 hours, she said. I don't mean I was unconscious. I mean I have no memory of 11 hours that my own debrief confirms I was present for and functional during. She looked at her hands resting in her lap. There's a version of that I could have worked through. I know people who did. But I stopped trusting myself. In that kind of work, not trusting yourself is how other people get killed. Greer said nothing. I was good at it, she said. And it wasn't pride in her voice. It was the inverse of pride. The particular exhaustion of someone who excelled at something that kept costing more than they had budgeted for. I was very good at it. Every time I was good at it, someone's family got their person back, and I told myself that was the calculation that mattered. That math held for a long time. And then, it didn't. And then it didn't. She looked up at him. I'm still good at it. Tonight apparently confirmed that in front of a surgical team. The corner of his mouth moved. In front of 7 witnesses and a documented incident report. Yes, that's going to be its own kind of problem. Doesn't have to be an unmanageable one. He shifted carefully against the pillow, managing the pain with the same economy he'd applied to everything since he'd arrived. There are people who would want to know where you landed. Not to pull you back in, just to know you're all right. A pause. I'm one of them. Margot looked at him for a long moment. He was older than she remembered from Kandahar, 3 years older, and the months since then had added something to his face that wasn't age exactly. More a kind of accumulated weight. But he had the same eyes, the same quality of attention, the kind that doesn't let things slip past without noticing. Brody's family, she said. Do you know if they're okay? He said it immediately, the way someone says a thing they've been holding in readiness. His wife remarried. His daughter started high school this fall. They're okay, Finley. She nodded once. Something in her face changed. Not dramatically, not visibly to anyone who wasn't looking for it. But it changed the way things change when a weight you've carried long enough to stop noticing it shifts even a small amount off the place it's been sitting. Okay, she said. They stayed like that for a while. The Admiral in the bed, and the nurse in the chair beside him. The monitor marking the seconds between them, neither of them, with anything left that needed to be said out loud. Down the hall in the trauma bay, the charge nurse was finishing her incident report. She got as far as patient-requested specific personnel by operational designation. Staff member confirmed capable of participating in support capacity under attending physician authorization, before she stopped and sat back in her chair. She thought about the 20 months of quiet lunches and steady hands, and the way Margot Finley always seemed to arrive. Exactly when a situation required her, without anyone having to call. She thought about the rolled sleeves and the low bun. And the expression that never quite cracked, under any kind of pressure. Not once, not even during the code in February, that had rattled everyone else on the floor. She thought that maybe ordinary was not always what it looked like. And that sometimes it was something much more carefully chosen than it appeared. She finished the report. She documented what she could document, and left the rest where it lived. Dr. Tarver signed off on the surgical record at 5:15. He listed Margot's role as supervised support, emergency exception, authorized by attending physician, which was accurate, defensible, and said almost nothing about what had actually taken place in that operating room between midnight and 4 in the morning. He had enough years behind him to understand that paperwork was the official record, and the room was the true one. And that sometimes they overlapped cleanly, and sometimes they described 2 different things that had both happened. When Margot left the hospital at 6:40 that morning, end of shift, badge scanned, same door as every other day, the parking lot was pale gray in the early light, and mostly empty and very still. She sat in her car for a few minutes without starting it. She thought about the questions that would come, and the conversations that would have to happen, and the shape of whatever came next. She thought about what Greer had said, about Brody's daughter, being in high school now. Then she started the car and took the long way home, the route that went past the reservoir, where the water was flat and calm, and reflected back the sky exactly as it was. The staff at Harmon Veterans Medical Center talked about that night for a long time afterward. Quietly, in the practical shorthand of a department that had worked together long enough to have its own language. None of them could explain it in terms that fit the vocabulary available to them. So they didn't try very hard. What they agreed on, without needing to say it directly, was something simpler. The nurse who ate lunch at the corner table, and never talked about the years before Portland, and always had steady hands when everything else was going wrong. They had not been wrong about her. They had just been seeing one side of something that turned out to have several. She was still Margot Finley. She had chosen that name and that life and that hospital and those shifts. And all of it was real. She just happened to also be the person who 3 years ago in the dark, on a mountainside with a burning vehicle, and no backup and no margin for error, had made 11 decisions in 40 minutes that sent 11 people home to their families. And she had never once asked for anyone to know.